Someone else tried to use our login.
I was gonna say, it just threw me off.
I know. I'm so sorry.
That's okay.
Hello.
Right.
There we are. Now can you hear me?
Well, that was kind of weird. I was kicked off of this Zoom for a minute and said somebody else is the host for this.
Yeah, someone else tried to use our account to start a meeting, and it bumped us all off. I apologize for that.
Oh, okay. I thought it was my lack of broadband internet out here in the country where I live.
No, surprisingly, that was not the cause.
Usually it is.
Okay, we're just waiting for everybody to come back on.
Sarah, I'm worried that I'm worried that they put that PPP meeting on this. Can you send them a link?
I already did. I sent it to them.
That was my guessing. Are people on here? You should take that off. That's recording. Can you stop recording and start again?
Oh, sorry. Okay, it's live.
Thank you everyone for joining us for this webinar. This is our second webinar in a series of community town hall meetings. My name is Wendy Tarr. I'm moderating this evening, and I'm with an organization that sponsors the Think Tanks on Poverty. With this webinar, it's being co-sponsored by our Perry County Think Tank on Poverty. We're really grateful to our leadership team for all the work they've put in to help bring this together. Our Perry County Think Tank on Poverty is one of our initiatives. We work to bring people together who are in the community that are experiencing the impacts of poverty or wish to work on those types of issues at a systems level, at a community level. And one of the things that we have recognized as a high priority for not only Perry County, but for the Southeast Appalachian region and other areas of Ohio is the need to access affordable high-speed internet. It's keeping the region behind. It impacts all kinds of things. In our last webinar, we had a pretty in-depth conversation about what all of that looks like, and we had a number of wonderful panelists. And we're continuing our conversation by honing in on a couple of different really critical and really timely needs around how broadband is impacting the community, the lack of it. And so this webinar is focused on telehealth and the way that healthcare systems are impacted. We're in the midst, of course, of a global pandemic, so it couldn't be any more important. And so I'm just extremely grateful for our panelists who are here to join us today. I mentioned that we have a chat box, and people can certainly, if you're on the Zoom call, you can certainly make on the Zoom call, you can make comments in the chat box. If you're receiving this on Facebook Live, we'll also be monitoring the chat function there if there are questions or things that arise as you're listening to our panelists. I'm going to go ahead and let our various panelists introduce themselves, and then they can share their name, where they come from, kind of where they're rooted rather in the community, and what their role is. And then just a quick introduction, and then we're going to move into some questions that'll dig deeper into your areas of expertise. And Carla, I know I see you there. Wonderful. Alrighty. I'm gonna go on my screen. Who's next to me is Peter. Peter, if you could introduce yourself briefly, that would be great, and then we will move along here. And make sure you unmute yourself. Thank you.
That's exactly what I was like. Oh, wait a second. I need to unmute myself.
Go ahead.
Okay, great. So thank you so much for inviting me to speak tonight. I really appreciate it. And I want to talk a little bit about who I am and what the Office of Broadband is doing in the state of Ohio. And I won't get into too many specifics on the telehealth right now or the projects right now. I just want to give you kind of a brief overview of where this administration is coming from and what we're hoping to accomplish in the very near future. So the DeWine-Houston administration has been taking a very deliberate and methodical approach to tackling broadband challenges facing the state. Right away, Innovate Ohio was established to streamline government processes and bring innovation to governance. Connected Nation Ohio was provided a grant of nearly $1 million from the Third Frontier to approve upon our outdated coverage maps for the state. An RFI was released in June of 2019 seeking input how to best leverage state assets in expanding broadband. Ultimately, that led to the state's first broadband strategy, which was released in December of last year. The major categories of that strategy are telehealth, which we'll be talking about tonight, a statewide grant, regulatory reform, economic development and entrepreneurial activities, digital literacy, rights of way, and an office of broadband. For telehealth, we are working on telehealth solutions to connect people with healthcare providers and leverage those efforts to expand access into our communities. As for a statewide grant, we are working with the legislature on House Bill 13, which provides money to internet service providers to assist them in reaching unserved and underserved areas of the state. That legislation passed the Ohio House on June 11th, and we're working very hard to move it through the Senate as quickly as possible. On regulatory reform, we have created a streamlined online permitting process through the Department of Transportation for access to non-interstate rights of way to maintain consistency in how people interact with the state. We're also working with the industry to identify key regulatory issues that stand in the way of expansion. Economic development and entrepreneurial activities is kind of just a long-winded way of saying that we are working with Jobs Ohio to invest in companies that are investing in Ohio and in our communities that need help. For digital literacy, we have just begun working with the Ohio Library Council on digital literacy programs so that people understand how to use the technology and how it can fit into their lives. For rights of way, we are finalizing a statewide interstate right-of-way access plan so that companies can work with a single entity, the Department of Transportation, from one side of the state to the other on broadband issues. And lastly, during the RFI process and beyond, we heard from numerous providers and stakeholders that they would like to have a single point of contact in the administration that focused on broadband issues. As a result, Broadband Ohio, my office, was created, an office that is a one-stop shop to work on connectivity issues day in and day out. Broadband Ohio is dedicated to two principles. The first is bringing high-speed internet access to every Ohioan. That doesn't mean that every Ohioan has to buy internet access, but we want to make sure that no matter where you live, you will have at least one provider who gives internet that meets the federal definition of high speed, which is currently 25 megabits per second download speed and 3 megabits per second upload speed. The second is building a best-in-class broadband network in Ohio. That doesn't mean that we want Ohio to own the network. What it means is that the service is reliable and dependable wherever you happen to be in the state. Broadband Ohio is technology and provider neutral. We're interested in innovators and new ways of getting internet into the home. And so let me talk a little bit about the two issues that face the state. One is availability and the other is access. Availability is the ability to have internet access in your home. Large parts of Appalachia, including some urban and suburban areas, and definitely including Perry County, have no internet providers at all and lack availability. And I'm going to share something really quickly if I can get it to work. 1 second. Let me separate it so you can actually see it. Okay, you should be able to see, I'm hoping, can you see the map?
Yes, we can see it. Thank you.
Okay, so this is the availability map for Perry County. As you can see, household availability is just under 60%, meaning that 40% of people in this county alone don't have the capability of getting high-speed internet access. And that shouldn't surprise any of you. I'm sure it's no surprise that Perry County has limited access to broadband. So I'll leave it up there for a second. access, so that's availability. Access is the ability to connect to the internet once it is available. In many areas, even when internet is available, it may not be affordable, or the home may not have a device to connect. If you look at the Perry County connectivity map, you know that this is a problem. You know from your own community that this is a problem. There are still large parts that don't have any service available at the federal definitions. So to tackle these issues, Broadband Ohio is doing numerous things to try to combat that. I won't talk about telehealth right this second, as I'll be talking more about that later on, but just a few things to keep in mind is, first, we're working on House Bill 13 with the Ohio legislature to create a grant program that we can tap into to be able to expand coverage. That tackles availability. And for access, there were two major announcements that happened last week. The first is that we're creating a request for information through the Department of Administrative Services in conjunction with Innovate Ohio, Broadband Ohio, the Management Council, the Information Technology Centers, and the Ohio Department of Education, which will create a transparent price list for all of our school districts across the state, public and non-public, so that they have a place to go where they will know that they're getting an apples-to-apples comparison between the two things that they want to buy. So if they want to buy hotspots, they'll know what our major providers are providing. If they want to do in-home internet service, they'll know exactly what they can get. If they need to do satellite, we're hoping that some satellite providers respond so that we can actually show people how much it costs so they have a better understanding before they go down the path of actually purchasing something. And the other exciting aspect here is that we have announced $50 million in a statewide one-to-one match grant through the Department of Education to allow school districts to be able to purchase the technology necessary to allow their students to connect to the internet. So what that's going to mean is that whether a school district has access to hotspots, a school district may otherwise utilize something for in-home internet, and there are going to be some school districts that have steady broadband service or lack cell phone service, and we're interested in seeing if we can create mobile hotspots by putting hotspots on buses to get out to areas, or by even increasing additional public Wi-Fi hotspots so that you can do some drive-up work. Each school district is going to be different. We didn't want to be super specific in how they had to use it. We just wanted to make sure that there were funds available so that as we get into the school year and as school districts make difficult decisions about whether we do virtual learning or whether we have places that students can go to be able to access the internet, we wanted to give them some possibilities. So we're excited about those two programs. I'll talk about telehealth a little later on as we get into some of the questions. And the pilot program that is currently underway. But I just want to give you a flavor for right now for what Broadband Ohio is doing. So I appreciate the opportunity to speak today, and I look forward to questions.
Okay, wonderful. Peter, if you could put that map back up on the screen and
Sure.
try to enter Perry County, because I think folks were having trouble. They couldn't see the county fully in the screen. That would be super helpful.
Sure. Is it up full screen now? Because when I do it on Zoom, it doesn't show me what you guys are seeing. It shows me like a little tiny window. So I'm hoping that you can. I'm hoping you can see that.
I see. Maybe what we can do is we can send that out also to
Sure.
out to the folks that are on the call later as a conclusion.
Why don't I put it? Let me do this here. Let's see if this. Let's see. Did that help?
Yes.
Okay. So. There you go. And I'm going to copy here. Let me copy the link and put it in the chat. So I'm sorry about that, everyone. I thought it was, on my screen, it showed that it was full screen. I apologize that it was difficult to see. Let me send it out into the chat so that everyone has, that's the link directly to the map. That's the 25-3 map. And again, that's the federal definition. One thing I do want to say is that it may come up, when in the questions. We do know that 25.3 has some limitations. It is not perfect. It is not, there are questions that we have been asked about why we use 25.3. The reason we use 25.3 right now is twofold. The first being that it is the federal definition of high-speed internet, even though it has its limitations. And the second is a lot of the technology solutions that we have been able to talk to some folks about, especially when we're talking about wireless internet service and things like that. A lot of them have the capability of utilizing 25.3 as a base and then increasing it from there. So we didn't want to exclude wireless internet service providers, new spectrum like CBRS, which is showing great promise in getting additional connectivity out into more rural, more hilly, more densely foliaged areas. And so that's why we're sticking with that definition for now. We believe it will change eventually, but we wanted to start by being in lockstep with the federal government before we moved on to our own definition. So I just want to put that out there because we've gotten that question in the past. I wanted to make sure that you understood why we started with 25.3. So again, thank you so much for allowing me to participate, and I look forward to questions.
Thank you, Peter. So I think what I'm going to do is that's super helpful to give us a grounding from the state perspective about what the state is doing. I'm going to ask the other folks on this panel are particularly within the medical field. So what I'm going to do is have the rest of you introduce yourself, give briefly like where you are and what your focus is, and then we'll work through the questions around the telehealth and how it's impacting things. And then Peter, if you have things to add, you know, as we're talking that are important, that reflect off of what some folks are sharing from the telehealth side, that would be welcomed.
That'd be great.
Dr. Ulrich, can you introduce yourself, sir?
I'm sorry, was that Dr. Ulrich?
Yes.
Okay. I'm Dr. Steve Ulrich. I'm a family physician in New Lexington, Ohio. Been here about 39 years. We have a rural health clinic and several nurse practitioners. I also have been recently board certified in addiction medicine, and I serve as a part-time medical director for Perry Behavioral Health. And we have like a 10-bed subacute detox center and a standing clinic for Vivitrol injections. My concern with computer systems and telehealth is that number one is computer literacy. It's a real issue for my elderly patients who are trying to sort out what they need to get, what kind of Medicare coverage or that they need. And it's basically a very intensive, am I creating feedback here somehow?
I'm not
here.
experiencing anything on
Okay.
my end. It sounds fine.
The problem is, especially when it comes to figuring out which Medicare program will best cover your medications and your copays, the best way of doing that is going online. And if you have a 66, well, I wouldn't say 66, but even 60-year-olds can have trouble trying to figure that out. And just to share a personal example, my mother ended up running up a bill for about 20 grand in 1 year for very expensive medication because she had no idea of how to apply online and see what would give her her best coverage for her particular prescriptions. So I think the literacy is an issue, especially among the older rural population, that has to be addressed, as well as the access. So
Yeah,
that's my biggest concern.
that's a really important point. Thank you so much. And please continue to raise that as we get into some of the topics, because I do think you're right. There's various constituencies and various parts of our community that may struggle with this at any number of levels. So thank you for sharing that story. Dr. Butterfield, can you introduce yourself, sir, and what your role is here in the community?
Sure. I was in family practice in Roseville for 37 years and retired from that to become the medical director for the Zanesville-Muskingum County Health Department. So practicing on Main Street in Roseville, clearly half of my practice came from Perry County. And also for the last 8 years, I have lived on a farm just outside Roseville. And my house is in Muskingum County. My mailbox, the other side of the road, is in Perry County. And so I can identify with Perry Countyans. Also, I will say I'm sitting here in my little home office in my basement, and I do not have broadband internet out here. I've had to purchase 4 Verizon jetpacks to get Wi-Fi or to get internet connection. And they only come with 15 gigs per jetpack. So with the amount of work I do online, I have to have 4 of those things. So I am a victim of the same issue of not having broadband internet availability. So there's a lot of things I can go into if you want to continue the introductions, or I made a brief PowerPoint of some of the issues that kind of overview of, as I see it, if you want me to bring that up or if you want to wait on
Yeah.
that.
Let's continue the introductions, and then
Okay.
as we move along, if there's components of what we're sharing, or if you want to just, if there's a segue to get into that PowerPoint, you're certainly welcome to share it at a certain
Okay.
point. Yeah, that would be wonderful. Thank you so much. And then Carla, hi there. I know you're here on behalf of one of the doctors we had invited. Could you introduce yourself and your role in the community? Thank you for being with us.
Hi, my name is Carla Ralston. I'm an emergency medicine physician that works for Genesis. I work probably about 50 to 75% of the time at the Genesis Emergency Department, and that's located in Somerset. And then the rest of the time I'm at the main campus in Zanesville. I am working closely with Dr. Bate, and kind of he's taken on some new administrative roles, and so I am starting to help him out and take over some of those roles, particularly hopefully with some community outreach type things to spread them out a little less thin. And I have grown up in Chicago. Where I have grown up, I have always had internet. Pretty much since I was, I don't know, probably 13. So I see taking care of patients, what a struggle it is. And especially now with telehealth really being a viable option in terms of reimbursement, especially for some of our patients who have difficulty getting to and from appointments. Seeing visits in the department that maybe could be taken care of otherwise through telehealth. That is kind of where we are coming from, and seeing how we can further facilitate that. Other than that, I am here to listen and to learn and to see what options we have coming from the emergency medicine side that we can help offer our patients, and what else we can do from our perspective.
Sorry, everybody, can you hear me? We have Judge Luann Cooper-Ryder, who also was going to just join us very briefly. Judge Cooper-Ryder, can you speak and see if we can hear you?
I can speak. You'll have to tell me if you can hear me. I'm not able to be at a computer right now, but can you hear me?
Yes, we can, certainly. And
Okay,
I know
wonderful.
Judge Cooper-Ryder, I know she has a tight constraint, but we were discussing her role in the community, working with a lot of juveniles and in the court system, and a lot of that deals with mental health. So we just wanted to give her just a second to share briefly her perspective on this, and what we will certainly pivot back to our original agenda. But I wanted to welcome her to and recognize her being here on this call today. And Judge, just to see if you could share just a few of your thoughts as we're doing these introductions, we would certainly appreciate that.
Oh, thank you, Wendy, for inviting me to be on this call. I was also on the call last month. Very impressed going, and thanks to all the medical people, Dr. Ulrich, Dr. Butterfield, and the other medical folks on the line for dedicating your careers to rural health care. That's a soft spot in my heart, so thank you for that. I've been a judge in Perry County. I'm finishing 30th currently, and so I work with kids and families. And I was asked to touch briefly on the mental health aspect of not having broadband internet. I run my own school for kids that, if you don't have internet, you can't do your schoolwork, you fall behind, lots of mental health there. You can't connect with your counselor because you don't have internet. So just all kinds of things that affect their education, their mental health. If they can't keep up, they get some depression, fall behind. Self-esteem. It's just all around a negative thing for the kids and families that I work with. I even have two staff members that have children that are in middle school and high school and where they live, they cannot obtain internet. So not only do I work with kids and families, but I have families that work for me that don't have internet. Our local library started a thing where you could check out a hotspot. That was very, very, very popular. And I thought that was pretty inventive for our local library system to be able to do that for folks. So the problem was with that, it was so popular, people didn't want to bring it back. So that kind of tells us how good that would be for people, how much they enjoy just having internet and access to other things in the world and social media with their friends, all of that connection that they just don't have. So I'd be glad to answer any questions as well. I certainly don't want to take up your time. Be glad to answer anything.
Okay, wonderful. Thank you, Judge Cooper Ryder. I think sometimes the court systems and the health issues that are interacting with our court systems are extremely important, and we certainly didn't want to overlook that. So we appreciate you being here and offering your thoughts. Did I get all of our panelists? I know there's a couple other people on here that I don't believe are supposed to be panelists. So I'm going to just kindly ignore you for a moment and move back to, we're going to figure out how to get our panelists straightened out here. I want to open up with just a certain question here, an opening question. Many people in other counties in Ohio are using telehealth, and the majority of you on here are medical professionals needing to see clients. I'm just wondering, is telehealth functioning in Perry County? I mean, are you able to utilize this in your practice? We saw the maps from Peter Voderberg from the state just about how spotty services are. So I just wanted to open up with a really opening question just to see generally, how is this working for you when you can't see people, or are you seeing people in person? And that'll be to any of our panelists that would like to respond, and I'm sure we can have a couple of voices jump in.
I'll be glad to respond to that. Number one, if it wasn't for telehealth over the last 2 months, we would be out of business. People are afraid to come to the physician's office. I've been doing telehealth for years. I just didn't get paid for it. It's called a telephone call. We triage a lot of calls, do I need to go to the emergency room or not? And having family getting reimbursed for that has been very helpful. A good deal of my telehealth is by phone call, simply because either the patient is not computer literate or they do not have access to the internet or to high-speed connections. We use a program called doxy.me that is an internet program, and when it works very well. But a lot of times, the voice is distorted, the picture's faded, or the patient has no idea that they're sitting totally in the dark with a bright sun coming through the window behind them, and you can't see even a facial expression. So I think that's a challenge. I'm really looking forward to Jack's PowerPoint presentation to see what he's come up with there. But to me, the biggest thing is having to rely on the telephone. Number two, computer literacy. And number three, broadband access to where we can do adequate visualization and communication with the patient. And I will mute.
Thank you. How about any others? So I just have a follow-up question because I am not a medical professional. And I did see my own doctor through telehealth. And it was an interesting experience because the call was dropping. I was on my phone. And she said, so long as we start the visit by telehealth, I can bill it and then I can just call you. So I'm wondering if you were saying, you would go out of business if it weren't for telehealth. So does that mean that the phone calls that you were doing previous to now, are you able to, how does that work practically? I mean, or is that something that you can explain any further to the rest of us? And you're
I always try to unmute in my picture and I can't do that. Prior to COVID-19, Medicare and Medicaid would not reimburse you for phone calls.
Okay.
And but yet we would handle as many as 50 or 60 phone calls a day. The staff kind of triaging, is this something that needs to go to the emergency room? I have a problem with my medication. Should I stop taking it? And I'm sure Jack can elucidate on that somewhat too. But now, because of the COVID crisis, Medicare is allowing us to actually use a telephone call as long as it's properly documented and there's an assessment and a review of medications, that sort of thing, and we get reimbursed for it. Part of our reimbursement pattern's a little different when it comes to Medicaid and Medicare because we're a rural health clinic. We get cost-based reimbursement for each encounter. But still, prior to the COVID crisis, all of that telephone call was free. Back in the early 90s, we actually experimented with billing for phone calls, and that went over with patients like a lead balloon. It was impossible to collect, and it frankly wasn't worth the time to collect for a $5 or $10 telephone call fee. So we found this very helpful and are hoping that CMS will continue to allow going forward telehealth, and especially for our elderly patients who are basically shut in, have limited transportation. It's a godsend, and the patients love it. So.
Thank you, doctor. That's really very helpful. Does anybody else have anything to add about that? And if you want to expand upon it, we were also just thinking, how can broadband, how does telehealth and telemedicine, we have some emergency folks on here too. How does it save lives? So are you seeing this? How is it functioning now? Is it different? Are you able to get folks on telehealth in your areas where you're serving?
So, I think that for, from an emergency medicine perspective, it's a little bit different in that we don't directly do telehealth. We see the other end of it. And so I think where the benefit is for maybe someone who normally would call and say, hey, I don't feel so good. What do you think I should do? The nurse or the nurse practitioner or even the physician on the other end may say, you don't sound so good. Maybe you need to go into the hospital. And for a lot of patients who are in rural areas who have difficulty with access, because of transportation, just money in general, I think if you have a face-to-face visit like this, if they're able to do that, it's a little bit easier to convince them. Plus you can really see them. And from a very short visit on telehealth, you're able to gain a lot of information. Even though you can't feel the person, you don't see them, in terms of being in the room with them, you do see a lot of it. I think the other, aspect is that what we've seen is that patients are going to the doctor and getting their refills on their medications. Whereas before, I feel like sometimes because it was harder for them, it would kind of lapse. And it's a lot easier for, say, a 75-year-old who's got, diabetes and has lower extremity edema, mobility issues to, for them to be able to have that visit, and then for a family member to go get those refills for them. I think that that's a huge benefit. I think also for some of the simpler things, now with telehealth, people are able to be worked into the schedule a little bit, easier. And so for simple urinary tract infections, sinus infections, things like that, the primary care folks are able to, get to them, and the patients are able to get, started on some medications. And so we are maybe not seeing quite as much of that. And maybe that's just wishful thinking on my part, but I feel like that's has been the case.
Yeah. Wonderful. Thank you.
I'd make a comment or
Yes.
two about this. Dr. Ulrich is exactly right. For years and years and years, telehealth was the telephone, which we didn't get reimbursed for. And the other thing that I know Dr. Ulrich does, and that I did, was the long distance telehealth, which was a house call. And usually you didn't get paid much for that either. But anyway, then we have had a version of telehealth in the hospital for probably 10 years or so. And that is telehealth with specialists that are not represented on a specialist panel in the hospital. We may have a pediatric neurologist, for instance, or especially in the pediatric field, because we have general pediatricians, we don't have specialists, like a pediatric endocrinologist or an adult neurologist when we didn't have neurology covered. So we have had telehealth in the hospital setting on a limited basis for years. Then Genesis brought to town Epic, which is the EMR, and it had developed what's called MyChart, which I urged all my patients to sign on to MyChart because it gave them email access to me through the medical record. So there was a definite paper trail documentation of everything that we had discussed. So if they forgot what we talked about last year when they got poison ivy, they can go to MyChart and look at it again. But it was a way to give them handouts. And for me, it was a way to, sometimes get the result for their mammogram before they get home from having it done. And so it was just a great way to communicate. So I really urge everyone that has a Genesis provider, sign up for MyChart. But the telehealth also, one of my concerns, and this goes with Dr. Ralston's field, is there are a lot of people that are simply afraid to go to the emergency room. And if the primary care doctor can have access to them by telehealth, they can assess how sick is that patient. You get kind of a gestalt of when you look at him, that's a really sick patient. And you kind of know who you need to send and who you don't, even without laying on your hands, which is a gold standard for what we do in medicine. So people are, they have chest pain, they talk themselves out of it being their heart, and then they die. Or they're short of breath, well, it can't be heart failure, and they die. So there are people that are the untold victims of COVID-19, or those that died at home of something other than COVID-19. And telehealth could play such a major role in preventing those unnecessary deaths. And Perry County is woefully substandard compared to Zanesville. Everybody in Zanesville has access. Where I live, I can see 345 out my window, and I know Spectrum goes down 345. It won't come a half mile to my house.
Wow.
That's right. That's not right. Perry County deserves this broadband coverage.
Yeah. Thank you, Dr. Butterfield. That raises a really good point. And I was framing this as telehealth, but I want to pivot just to the broadband piece in general, because, speaking about people's heart issues and conditions, and you're right, under the certain circumstances, and we don't know how long it's going to continue, folks are very reluctant, to enter into a hospital or even a doctor's office because of fear of COVID or other types of transmission. So I think with broadband, we're also interested in there's EKGs and there's other type of monitors that go inside folks that are monitored through broadband that I know are impacted, as well as Carla, the first responders that are trying to get to we had a member of our group, well, a few years ago, share a story. She's not on the call today, but of a person that there was a car accident and she had to call 911, but like the way that they needed to triangulate the call in order to dispatch folks was hampered because of the lack of connectivity. So I just want to kind of throw those little pieces out on the table and see if that spurs any comments on your end about, how this impacts, additional things besides just the telehealth visit, the lack of broadband.
What I can tell you is, as far as monitoring, for instance, people with pacemakers, I happen to be one of those people. And we had a landline in our house, and the pacemaker downloads every so often, like every night, I think, to the device center. And we got rid of our landline. I didn't realize it was going through the landline. I get a call the next day to find out if I'm okay, because it didn't download. And so we're checking the device. Then it occurred to me, goes through my phone. So the Boston Scientific actually had to send this little device that's basically a Wi-Fi internet thing all on its own that plugs into the transmitter so that I can have that report. And there's extra cost in that. And so people with pacemakers, if you're having trouble, you can push the button. It goes immediately to your doctor, and he knows what your issue with the cardiologist. So that's just one example of how the internet helps monitoring people at home in addition to just helping save lives.
Thank you. Carla, did my comment about the 911, how does that function?
So
You can correct me.
I think that
story.
no, you are absolutely right. It depends on where you are. If, let's say, you have, if you are involved in a car crash in rural, Perry County, and even if you have a cell phone, you may or may not be able to get that 911 through. And then, then you're really ultimately dependent upon, where are you? Is there anyone around you? And is anyone passing by? In terms of the call centers, I'm not sure how that works with the, if you are in an area that has no receptivity, in terms of how that gets routed. And that's what that sounds like. It sounds like maybe it was, one of those situations where it got routed to somebody else and then had to kind of go through. Yeah. And there was I see in the chat here, there was a question about, transmitting EKGs directly to us. So let's say, a squad goes out on a chest pain call and they do an EKG. A lot of times they are able to transmit that EKG directly to our emergency department. So someone walks up to me, hands me the EKG, and I look at it and I can tell them, I can see if that person's having a heart attack at that time. And depending on where they are, I may redirect them to either to Fairfield or, directly to Genesis, depending on the location. Because obviously at Somerset, we don't, currently have, a cath lab. Or, I can give, more, medical advice if they need something from medical control. Now, depending on what squad that is, who is on the squad, and the capability of the truck, and what they're able to connect to, that does make a difference. Yeah. Does that make sense?
Mm-hmm. Are there other devices besides like heart devices that get impacted by this lack of broadband?
No, the other example that I can think of would be the pacemaker defibrillator that Dr. Butterfield had referenced, but that is not something that EMS personnel is able to access. We have devices in the emergency department that is able to interrogate them on their own. I'm not really sure. I can't really think of anything else off the top of my head that would be kind of a transmissible type thing. EKGs are the biggest ones for sure.
Yeah, absolutely. Does anybody have any other comments? And then I'm going to ask Peter a question from kind of his perspective at the state. Is there anything that anybody else that this kind of stirred with you that you wanted to share briefly?
Yeah, sure. I'll jump in here for a second and talk a little bit about Broadband Ohio and some of the things that were brought up by the physicians. So one thing I do want to say is that it's good to hear about the utilization of telehealth, especially since the suspension and waiver of some of the rules, both from Medicare and Medicaid. I actually had a phone call with health insurance plans just recently, and we were talking about how, right now all of those waivers and suspensions are temporary, and really having a conversation about what makes sense and starting the conversation about what makes sense. Like, now that we have seen during a global pandemic, what are some of the regulations that make sense that maybe we should go back to, and what are the ones that now that we've suspended them, we should just keep suspending or recommend that they stay suspended. So this is part of what Broadband Ohio, part of the reason why we talk about regulatory reform is because, broadband touches all of these aspects, right? So when we talk about telemedicine, it's difficult to decouple it from a conversation about what's reimbursable, right? Because if we say it's non-reimbursable, that's not I'm a broadband person, I'm not an insurance person. But again, if it's non-reimbursable and 1,000 people want to do it, I don't know how we would pay for those people, right? So talking through with Medicaid and Medicare and saying what makes sense, like what are we seeing, how is this happening, what makes sense from a regulatory perspective, that's really important work. And Broadband Ohio is beginning some of those conversations from a state regulatory perspective, because we may be able to recommend to the federal government what they should and shouldn't do, but we can really definitely have a conversation with our own insurance policies and stuff, just about what are we seeing, what are some of the things that we're seeing now, so we can talk through what regulations make sense on telehealth. Because again, all of us, as the doctor said, they've been doing a great job of doing telehealth up to this point, especially using the phone. But now we've kind of all gotten a crash course in Zoom and what's HIPAA compliant. How do we make sure someone understands, like, don't have someone in the room that you don't want to hear the medical information on? How do we make sure the doctor's in a place where they can maintain confidentiality and privacy? How do we make sure that it's secure from a cybersecurity perspective? What are the things that we should really be talking about, so that as people need to utilize it more and more, we have a good and robust methodology by which we can say, like, these are the regulations that make sense, so that we can get telehealth out as much as possible in a safe manner. So I really appreciate everyone talking about that, because again, that is a very important aspect of all of this, that we are learning kind of as we go with our response to COVID. So it is something I don't pretend to have a solution for it right now, but it is something that has come up a lot recently, and something that we're starting to have conversations about.
Thank you, Peter. And this is part of our hope with these calls and these meetings, is that we can raise a range of experiences with this, because I think a lot of times these conversations are dominated in the larger metropolitan areas or the cities, and sort of that's where a lot of the need is identified, and solutions and things are sort of driven out of. But when we get into some of the rural areas, it becomes really a lot of different layers and a lot of different contours to this, and we really don't want that to be lost. So thank you for recognizing that. It's been interesting in the chat. There's been a lot of folks I don't know if you've been seeing it. They're like, I keep getting kicked off of this webinar because my internet connection's unstable. Of course, imagine if you're having a family member having a seizure or something, trying to contact someone. We're just trying to have a conversation. This isn't, hopefully for anybody here, is not in the middle of a medical emergency. But I think it just underlies the need for this. And so I appreciate even just your attempt to communicate your frustration with that. It's the reason why we're doing this work. And then some other folks in here have commented about maybe wanting to purchase property, or the inability to telework from home, which is another thing. We're trying to focus today on the medical, but it's the same. Our medical offices are in fact workplaces. All of these folks are professionals employed and trying to serve this community. That was one of the things I wanted to make sure to highlight. And Dr. Ulrich, I know you mentioned it. I don't know if there's anything else to add. I was really concerned, as this pandemic moves along, if folks don't come to their primary care family doctors because of, just fear, and you put that thing off because of the concerns, or maybe you're elderly or you have a pre-existing condition, will these offices survive? I don't know the answer to that. I certainly don't want to be alarmist here, but I think it's important. If there's anything else you want to say, I don't know if telehealth creates a solution, but certainly broadband would enable a way for you to serve the community, and perhaps keep some of your clients connected to you. Again, I'm a layperson trying to understand it. If you have anything further to add, we'd be happy to hear you. And then Peter, I'd like to kind of also ask, I have a couple of questions for you, so I have to look at what those are. Dr. Orlick, did you have anything further to add about your experiences just as a local physician?
I would say I definitely see patients, not getting their labs done, not seeing the specialist, all because of fear of COVID-19. I think the fact that I can reach out and get compensated for talking to them and then being able to assess, okay, yeah, maybe that's appropriate. You're 90 years old and, clinically you appear stable and yeah, we can safely wait on that. Because some people really get very anxious because they want to go get the lab done, they want to go see the specialist, but they're equally scared of getting the COVID virus.
Right.
And that ability to reach out and touch. And I wish you could have had some of the mental health providers on tonight because I would have been very interested in hearing their perspective. I can tell you that some of my patients don't like seeing the psychiatrist by telehealth. They sort of feel it's too distant. Others are very happy with it. I do a lot of more than I probably feel comfortable with my Suboxone patients. I'm doing quite a few of those by telehealth, but I still need them to come in for their drug testing. And so I'll see them under those circumstances. But I know Perry Behavioral Health is doing a lot of the drug counseling now by telehealth. And without that internet connectivity, it's an issue. Also, the other thing is that in this COVID-19 thing, especially with my mental health patients, there is a lot of loss of social connections and the ability to communicate with others. And for some of these people, it gets them really depressed. And I probably have one or two people that may have indirectly contributed to their deaths. I had one patient, as a matter of fact, just a week ago, he'd just stopped taking all of his medicine. He said, what have I got to live for? I can't get out of my house. I can't do this. I can't do that. And doc, I just got tired of it and gave up on all of it. Thank God I was able to reach him. And once we started talking, it's, hey, you were feeling better, when you took the medicine. Hey, you can still go outside and walk around your house if you want to do that. I got tickled tonight. I've got an elderly lady who's on oxygen. I think she's in her 90s. And she lives with her daughter on the Muskingum River. And the daughter said it's close enough that she can actually fish in the river from the backyard safely, but she won't go outside because she's afraid of catching the virus in the air. So I told her it's time to go out and maybe do some fishing. So it's kind of neat to be able to get reimbursed for the time to give that kind of advice that really makes a difference in the quality of the life of an individual. And I think, Jack and I can both speak to the amount of time that ourselves and our staffs over the years, all that uncompensated time that we spent on the phones, which prevented us from seeing patients that we got paid for. And but that's a whole separate thing on reimbursement and how we pay for healthcare in this country. However, I am very appreciative that the state, and Peter, I really encourage you to push this with especially the Medicaid providers, really consider making this a permanent change in how we deliver care here in rural Ohio, and probably in the inner city too. They may have more internet access, but I'll bet you there's a lot of computer illiteracy and lack of money to connect. I know I have a Suboxone patient from Zanesville, and she was having to use her daughter's iPad to connect to my office, and the daughter's iPad got broke. And so now the daughter can't go to school, and there's no access to internet. So, I was kind of hoping to see Jack's PowerPoint presentation if we got time.
Oh, no. Okay. Jack, was there something that you wanted
No.
to share?
No, this has been much better discussion. Steve, I'll send it to you. In fact, I'll send it to you, Wendy, and you can post it if you want to. It's just an overview of my concepts of this, but this discussion is much, much better. The other thing I'll tell you, and I want to direct this toward Peter especially, necessity is a mother of invention, and COVID necessitated the expansion of telehealth. It is here to stay. There are a lot of patients that like it. There are a growing number of physicians that like it. It is efficient. And so it is here for the long run, long after COVID-19 is gone. Therefore, it is incumbent upon our representatives in government to make this happen for the betterment of everybody. Is broadband a right? No, it's not a right, but it should be available to everyone to use. And they have to pay for it, I get that. And if you have to pay for it, it's not a right, but it should be available so that they can access it. And telehealth is going nowhere. It's going to grow over time. So that's
Yeah, and I think, I just want to echo Dr. Ulrich's interest in hearing from the mental health field and the addiction field, and that may be something that we maybe will sponsor a conversation on that in particular, because I know with the overdose and the addiction crises, and of course, I'm a mother with 2 small children, and I'd be lying if I was to say I'm not concerned about my kids' mental health through this. So, even folks that haven't been with a physician or not even a physician, but with, a mental health provider, may be seeking that type of help. And the more you can make it available, like you're saying, Dr. Butterfield, more accessible to folks, perhaps we'd be able to do more interventions earlier on. As people gain, and the younger people that we have are more savvy with the technology, and youth health, mental health is also really critical to catch early. So thank you for raising those comments. I want to say everybody's doctor. I don't know if you're a doctor, Peter. Maybe a doctor something.
I'm a
Peter.
lawyer, so I'm a juris doctor, but I'm not a medical doctor.
Got you. Okay, forgive me. So currently the Federal Communications Commission has a rural health care program in place to provide funding to eligible healthcare providers for telecommunication and internet services to provide healthcare services. Are there funds available to our rural schools to address, these mental health issues with kids following COVID-19? Is there anything that we might need to be aware of? Does that question make sense?
Sure. And I'm going to bring up another, so I'm going to put this I'll put this link in the chat again, but let me share this really quickly, and then I'll talk a little bit about this to start with. And, okay. So this is what you're looking at. It should say Broadband USA. Can everyone see that? Or can you see that? I guess is the question.
Yes.
Okay, so this is a cheat sheet of, in essence, all of the funding opportunities that exist right now from the federal government to be able to go towards pretty much any kind of broadband expansion that you could think of. So if you look along the left-hand side, it has everything from select agency, department, program purpose, and then eligible recipients. And just to do a quick search so I could show everyone, I've clicked hospitals. So each of these different programs that you're seeing now as I scroll through them, each of these are able to be accessed by hospitals. So there's the ARC Area Development Fund, the Central Appalachian and North Central North Appalachian Broadband Fund, the Distressed Counties Fund, the Power Grants, and then the Community Infrastructure Fund, the state's Economic Development Assistance Program, and then the one that most people have been talking about recently, which is the FCC Rural Healthcare Program. And then we can go down and you can see the National Science Foundation, and then the USDA Rural Development Distance Learning Telemedicine Grant Program. So right now, from a federal perspective, and again, I'm going to take this, I will take the main page of this and I will put it in the chat for everyone. But the answer is, from a federal perspective, there are dollars that are available. Typically what we're running into right now is that a lot of those dollars need to be applied for either by an internet service provider themselves, or in the case of what I just showed you, a hospital. And so during the COVID crisis, we have been the main points that we have been working on in the short term. We're just trying to make sure that we had as much coverage for short-term solutions, short-term band-aids, everything from mobile hotspots to the hotspot locator to working with our providers to stay on the Keeping Americans Connected pledge, which for a short time made sure they wouldn't shut anybody off for non-payment. So now that we're past that initial kind of rush of things, we are able to work a little bit more on the long-term plans. And what we've been doing is reaching out to our local development districts, both through the Governor's Office of Appalachia and working with some other community groups to really form the partnerships necessary to be able to really figure out a way to tap into these funds. So for the most part, Broadband Ohio itself doesn't have the capability of going after the federal funds. Those funds are available to specific different types of community organizations, whether they be the hospital or healthcare provider themselves or the internet service provider. So it is going to take some coalition building and the utilization of folks like your own organization, the Perry County Think Tank on Poverty, and talking through how we can make those connections so that we can have conversations to be able to get internet out either through telehealth or through other means. We've also been working with, and we're at the beginning stages of trying to put together a telehealth toolkit where we'll have the capability of basically having 5 or 6 different telehealth programs to choose from, so that when a hospital indicates that they are interested or a provider indicates that they're interested in doing telehealth, we can kind of show them a blueprint of how to get there. What we have been finding out is that we talk about telehealth, but it can take a lot of forms. So I've talked to one nonprofit who basically what they do is they partner with hospitals to be able to provide cell phones to people who are in recovery so that we can see better outcomes. Because what we have seen happen in certain areas is that someone goes through a recovery program, and making sure they can stay connected with their doctor is one of the best indicators of a health outcome. But if they don't have cell phone coverage, if they don't have a cell phone of their own, or they don't have home phone coverage, they sometimes lack the ability to do that. So what this provider or what this nonprofit is seeking to do is put cell phones in the hands of people with minutes that they can use so that they can communicate with their doctor so they have a better health outcome. So that's again, going back to the idea that a phone call is telehealth. That's a way to make sure that people are connected. And that's an idea that's being looked at in the Cincinnati area. In a minute, when we talk a little bit about telehealth, I can talk a little bit about our telehealth pilot program that we are working on. If you want to talk about this broadband strategy quickly, I can segue into that.
Yeah,
so the other thing that we're doing is we are trying to see how we can partner behavioral health and telehealth together in a rural setting so that we can make sure that we can get out to the Appalachian region the telehealth resources that they need. So right now, the state of Ohio is, in fact, the question that has come up is, in the broadband strategy, there was a section that talked about telehealth that in essence said that one of the goals was to stand up a telehealth pilot project. And I'm pleased to say that there is, in fact, a telehealth pilot project that's going on in the state. The reason why people don't know about it is because this is not an exaggeration. The day the Lieutenant Governor announced the telehealth pilot project in Monroe County was the literal same day that the governor took the stage right after that announcement and said, ladies and gentlemen, the first case of COVID-19 has happened in the state of Ohio. So it was at the beginning of March. So as you can imagine, most of the headlines were state announces telehealth pilot program in Switzerland of Ohio School District. Most of them were COVID-19 in Ohio, and we've been kind of going through with that ever since. But the good news is that pilot project didn't go away and has been going along. So to talk a little bit about what that pilot project is it is a part of the broadband strategy that was released in December of last year. And the hope is that we can leverage telehealth to be able to increase connectivity to the surrounding community, because when you have an anchor tenant like a hospital or a healthcare provider, they are a regular client. They need a lot of bandwidth, they need a lot of connectivity, and then that those people are going to pay on time every month. And so as an anchor tenant, it helps increase the amount of broadband you can push out into the community, because a provider knows, well, the hospital is getting connected, I might as well help wire up the surrounding community because it's just a way to value add. So what the pilot program is doing is it's in Monroe County, which, if you can imagine, actually has less connectivity than Perry County has. It's in the 20% instead of the almost 60%, which, again, neither of those things are great. I don't want to say that Perry County isn't in a difficult position, because you definitely are. I'm just saying that Monroe County is in a similarly bad position. And so what we are doing is in Switzerland of Ohio, it is 8 buildings that are spread out over just about 500 square miles. It's actually a little bit over 500 square miles. And they only have 2 behavioral health therapists for the entirety of that school district. And as many people know, it is a goal of the administration to make sure that every child has access to behavioral health services when they're in school. What was happening in Monroe County is that a behavioral health therapist would be in one building and then be called to an emergency situation in another building to be able to go respond to a child in crisis. They had to get in their car, drive between 35 and 45 minutes from one building to another without any cell phone service in between, by the way. And then once they got to the second building, they provided the intervention and then went back to try to see how many of the students on their original caseload they could handle. The worst story we heard is that one of the therapists was in one building, got called to another building, drove 45 minutes there, provided a behavioral crisis intervention, got back in her car to drive back. It took her 35 minutes to get into cell phone coverage, and the school building that she had just left had been frantically trying to get a hold of her, asking her to turn around because another child was in crisis. So she spent 70 minutes in the car with no cell phone coverage, without providing any services, without being able to give any, without being able to be on her original caseload, and just had to turn around to come back and do another crisis intervention. And that doesn't make any sense. So I know that, there is a question about, from a behavioral health standpoint, are people going to accept telehealth? The hope that we have is that because we can normalize it and have it be a part of the programs, that the young folks who are going to use it, especially because a lot of it will be used for crisis intervention, will still serve the purpose we're looking for. So the first phase of this program is that no matter what school building that behavioral health therapist is in, they can utilize telehealth to talk to any other student in any other building. So if one student is in one building and one student's in another building, they can talk from building to building. Now, the reason why that can happen, and why it can even happen in a place like Perry County, and why we're starting with school districts, is because our school districts are on a separate program from anyone else called ORNET. ORNET is a dedicated fiber optic ring that exists for the state of Ohio for education and government purposes. So while it can't extend out into communities because of how it was paid for, which was by federal funds, meaning you can't have more than 10% of it be utilized for private purpose, it does mean that you can utilize it for school-to-school communications. So what we're able to do is increase the bandwidth utilizing ORNET in the school districts so that all of those buildings have the capability of having a robust internet connection. We've also provided a redundant circuit of 100 megabits per second so that even if the primary connection gets cut from one school building to ORNET to be able to communicate with the other building, there's a separate line that only the behavioral health providers and health providers can utilize to be able to stay on that call so it doesn't get dropped. So that's the first phase. The second phase is we're working with the behavioral health therapists and the school district to see if we can increase connectivity to the school system and to the behavioral health therapist office to see if we can get a better externality, meaning that the community around the school building and the community around the office will have increased connectivity. So we're, again, going back to that idea of an anchor tenant. Can we create anchor tenants utilizing telehealth to expand access into the community? So phase 2 right now is in the planning stage because, as you can imagine, it's a much bigger undertaking. The phase 1 program, in essence, we've already built out. We're utilizing OSU as a consultant to make sure we don't miss anything, but we're actually hoping to have phase 1 be finalized before the end of this calendar year so we can actually have it up and running and useful for the students. Phase 2 takes some more doing because we have to make sure that we utilize a program that makes sense for the community and for the provider. And COVID has turned everything on its ear, right? So right now we're having conversations about whether to tool phase 2 to be much more interested in trying to push additional communities or additional connectivity out into the community, utilizing already state-owned assets like our Marks Towers and like other buildings, or whether we're going to go back to our original plan of increasing connectivity to our school buildings and to the provider. I don't know where that's going to go yet. We're utilizing a team out of Innovate Ohio, which has a lot of people smarter than I am, and we're trying to figure out what makes the most sense to be able to do the most good for the least amount of cost, utilizing the dollars that we already have. The last thing I'm sorry, there's one last part, and once I finish that, I'm free to answer any questions about it. So the last part of this is we're creating a blueprint that school districts can use. That blueprint will basically say, here are all the questions that we went through with our Monroe County pilot program. The first question is, what are you trying to solve for? Is it behavioral health? Is it primary care? Is it communicating with a hospital that may be far away, right? Some of our places, the nearest Medicaid accepting hospitals in another state, for goodness sakes, right? So what are you trying to solve? And then go through the things we learned, the questions we had to ask, how we had to figure out how to set it up. And so a school district can then make a decision going forward as to saying like, okay, well, do we want to go, even something like, do we want to go it alone or create a consortium? And we're going to create that document, and it's going to be iterative. So we're going to allow, it's going to evolve as our program evolves and as we answer more of our questions. But that'll give school districts the opportunity to say like, hey, I want to do telehealth as well. What should I be thinking about? And then have a blueprint to say, here's what you should be thinking about. What's the problem? Do you already have a relationship with the provider that can solve the problem? Do you already have a relationship with a broadband provider that does anything beyond E-rate? E-rate's the solution that you utilize with our ITCs to get additional broadband coverage. And it'll just be a step-by-step guide. And if someone goes into it and says, gosh, I read this, but I have questions, then Broadband Ohio and my behavioral health team and my team that's already been working for the past few months on the telehealth pilot project, we're going to help answer those questions. I guess what I'm trying to say is we really are dedicated towards trying to get this behavioral health telehealth pilot project off the ground. We have a lot of successes. They've already purchased a lot of things they need for the program, and we're hoping to have it up and run by the end of the year. So that's kind of where that is. I just wanted to give you that update. And we don't know what funding will look like for that program going forward, but it is a conversation we're going to be having in the next biennial budget, which starts next year. So.
You knew that's where I was going to go.
Yes, so I knew. I was like, it is a pilot project.
I think a lot of times we hear about these pilot projects that are innovative and that are usually successful, even in small packets, but don't always get scaled. And so I think that, you know, I'm interested in that, and I'm sure our schools, you know, we have folks talking about the lack of mental health services in the school system, which is a whole nother area of the budget. But I think that what you're describing is helpful. I want to know, and that's an area that you're attempting to try to make some headway. We're at 7:12. I know we wanted to try to complete by 7:30, so I think we're good. Kind of our concluding question that I just wanted to throw out for our panelists, and if anybody has questions on our through our attendance, if you wanted to pop those into the chat. If there's something that we haven't spoken to that you're kind of sitting with as you come to this webinar, we'd be happy to hear that. But, you know, where do we go from here? What is the path forward? I think you're offering one potential way around with the schools. But how can Perry County and those in rural Ohio who lack high-speed internet obtain adequate services? You know, we're in the pandemic now. I know it's not going to happen tomorrow, but like, is there anything that Peter, that you want to share, or that any of our other panelists are aware of that the folks in the community may need to know about, or may serve them in this time, you know, when maybe they are fearful to go to their doctor?
I have a comment that I'd like to make. I was sitting here listening to this conversation, and it occurred to me that in 1944, about 6 years before I was born, my mother's family in Southern Illinois got electricity for the first time. And it was through the Rural Electric Association in our community. And so I wonder if there's a role, or if the state has looked at the role of co-ops, especially in our more dispersed rural communities, where the financial return for the larger, quote, utility type companies may not make sense. I know that model, well, actually the first REA started in Pequot, Ohio, if I remember right, which was right here in Ohio. But that made a tremendous difference in the lives of those people in terms of health. And, you know, in recent years, we've seen investment in sewer system. I'm also a member of the Board of Health for the Perry County Health Department. And recently, our little town of Rehoboth, Ohio, it finally doesn't smell too bad when you drive through 345 with infrastructure. And so I just would, I guess being a country boy who grew up with REA, I'd like to put in a plug for at least that is one of the alternative models for payment. I think there's no question that that getting the schools involved, and you know, if the government can provide that for schools, why can't we access that through a private-public partnership of some kind? Because that, you know, I sat through a Perry County Poverty meeting one night when the folks from our regional Appalachian folks were up talking to us, and they kept talking about the final mile, that communication has to go. And I think that that would probably be at least a thing to consider. So that's the only other comment I really have to make. And if you do have something on mental health, please let me know. If I'm not a panelist, I would certainly log in and offer my questions and comments. And thank you for asking me to be on this.
Thank you. I know Peter may have a comment to that, but I do want to say that at our last webinar, we had a gentleman named David Brown, and I was pulling up the Facebook group just so that I can make sure to say it correctly. So he has a group called the Southeast Ohio Broadband Cooperative Exploratory. And so that's the name of the Facebook group. And I'll say it one more time. Southeast Ohio Broadband Cooperative Exploratory. They have over 1,000 folks on their group, and they're doing what you're discussing, Doctor. They're talking about getting a cooperative together. They're servicing they're trying to service a number of counties, and they're still, again, in an exploratory phase, but they're quite, they seem to be quite focused and serious about that goal. And so I think that you know, that's a wonderful thing to look into, in any ways that communities can. Another reason why we want to do these webinars, you know, any ways that our communities, we can start to draw like folks in through these conversations and help generate any type of momentum or raise up any of the possibilities that are advancing the technology. We want to be doing that. Peter, did you have any thoughts about that, or?
Sure, I'll go quickly because I don't want to keep monopolizing. I apologize. So, two quick things. One, the governor is part of a group of governors that wrote a letter to Congress, and basically it's called the Land O'Lakes letter because it was originally pushed by the Land O'Lakes company, and it basically says that we do need to have something akin to what you're talking about, which is, you know, a large-scale federal program that otherwise takes advantage of pushing broadband out into rural areas in the same methodology that we pushed electricity out through the Rural Electrification Act. So he signed on to a letter that agrees with that. The letter is relatively high level and vague because we didn't want to they didn't want to just say like, here's the program, A, B, C, D, E, F, G, right? They wanted to say, you need to do this. This is how much we think it will cost. It will have great benefits for the country going forward. And so we've signed on to that letter. When it comes down to rural electric co-ops or an independent cooperative, we completely agree. The state of Ohio does actually currently have a few rural electric co-ops that are, in fact, utilizing their own infrastructure, their own poles to be able to push out internet to areas that are otherwise underserved. One is just outside of Cincinnati that's in a rural area that was otherwise unserved. Another one is in Dublin. I do not have a great answer today as to why that hasn't caught on more. We are working with the Rural Electric Co-op Association to try to talk through, like, how can we do this? How can we replicate the success of some of these counties, especially when Mississippi only recently kind of changed their regulations to allow it to happen and have seen an explosion in utilization of rural electric co-ops to move internet out to people. So it is something that can be done in the state of Ohio. It is definitely a solution that can be looked at. And I would be interested in helping anyone who wants to know kind of, you know, if a rural electric co-op basically wants to look into it, I would, you know, offer my services to help them connect with their association and connect with a provider that might be able to run it for them and see what we can put together. So I think that's a great idea, and would be more than happy to help do what I can to get any information you would need to kind of look at that as a solution. So.
Thank you. Does anybody have any final comments about anything that you feel like you need to state before we wrap up here? It's 7:20. And then if not, I'm gonna invite our host to invite, yeah, there we go, David, to plug our next conversation. Was there anything else any of our other panelists just felt a burning need to jump in with? We really, really appreciate your time and your expertise and your wisdom and experience. kind of shedding a light on what this looks like in real time, real life in our community. Such an important issue. I also just want to thank the Perry County Think Tank on Poverty. We have a leadership team that has been meeting quite diligently, to figure out how to respond and do our part. We can do a certain piece, and this is part of it. So we're grateful to all those folks that participated in that and in the time that they've put in as volunteers. And then David, we have, I don't even know if I'm going to say your name right, Roop? It could be Rupee. See, this is where I should have been able to check with you before we got started. I apologize. But David is the Director of Operations for New Lexington School System. We had Superintendent Casey Coffey on the last webinar, and the implications for schooling is really, really critical. And I think we continue to be in a sense of unknowing regarding to what extent children are going to have to be doing their education online as this pandemic continues to play out. And so we're interested in, we don't have a date yet, I don't believe, for this next webinar, but certainly folks that are either on our call right now through the Zoom, that we would have your email if you've registered for this, and if not, you can check out our website. It's broadband4ohio.com with the number 4, so broadband, the number 4, Ohio spelled out, .com. If you go on there, you can sign up and make sure that you are in our email listserv in order to get notification about the details for the next conversation. And David, do you just want to give us a little teaser on where you're at with the schools? I know it's like every day is a new challenge here, but we certainly wanted to invite you just to share a couple of words regarding that, and then we can wrap up here.
Sure. Really appreciate that. I want to thank everybody for the great conversation tonight. As a school district and a school official, we've definitely put our plan together. Looked over Governor DeWine and ODH, as well as our local health department, Perry County Health Department guidelines, and have worked with our health commissioner and her team, as well as collaborated with our school districts within Perry County, to really share a lot of ideas. We've had a few meetings and conference calls. But yeah, definitely one of the things that all districts are doing is putting a plan together that will address the alternative education or that remote learning piece. We at New Lexington, just to speak on our behalf, we have invested in one-to-one devices for our students. We've released our guidelines that has the opportunity for alternative education, whether that would be full-time for those families to do, or it could be a 5-day-a-week in-person schooling with that opportunity for if a student is tested positive or a family member, they're quarantined, that we could seamlessly put them right into the online activity, and when they're quarantined, they're not missing a lot of school. We've tried to learn from this past spring, like many districts have, and we have purchased as well a lot of the hotspots. We did some trial runs with many different companies of going out into areas of our district, many valleys and rural areas, to test which ones were going to be the best for if we have families in those areas that needed that. We're also working with a local healthcare group on some telehealth at our district. So it was really neat to see the telehealth discussion tonight, because that's something that we're developing is a wellness center within our district, where we would have an RN care manager as well as LPNs that would help manage, screen in, and then we could transport to a local healthcare facility in New Lexington, and also have the telehealth capability to have those conversations even if we had the families in there. So it's very robust. We're still building this plane as we fly, but I think it's going to be a really neat situation once it's in place. But the broadband is something that I'm fortunate right now in my location in Perry County that I have access to it. But I know that there are many of our employees as well as our families that don't have the opportunity to purchase that broadband. And I know that some of them have the satellite and some different types of internet, and they're paying 2 and 3 times the amount I'm paying for, very high speed internet, which, I guess that's just the way it is right now. But if we can change it, I think it'd be great. So
Yeah.
definitely want
That's
to
a
thank you.
significant equity issue. Yeah, I mean, I think, yeah, I'm sorry, I didn't mean to cut you off.
No, you're fine.
So being able to provide those devices is one of the hurdles, but if you can't connect it to a proper internet connection, or if it's not fast enough or too expensive for your family, it doesn't solve the problem. So
Yeah.
we appreciate your comments and all of the hard work that the school district is doing to step up to the challenge here. And obviously, we need to continue to figure out how to get the different stakeholders involved in order to help create the most opportunity and the best access for this community as possible. So thank you so much, Dave, for joining us to just share briefly about that. And we look forward to that conversation. If folks actually have questions around the school district and the connectivity broadband conversations, you can also certainly share those with us over email or through our website, and we may be able to work that into our agenda. So thank you again to our panelists. Again, Peter Voderberg, Dr. Butterfield, Dr. Ulrich, and Carla Alston. We're just so grateful for your time. And we look forward to continuing to work with you and your service to our community. Thank you. And we'll conclude.
Thank you.
And if we could turn off the recording too, Sarah. No, I don't think I'm the host.